review the effects of a curcumin supplement on patients with persistent Lyme disease. And as a matter of sort of introduction, my name is Tom Moorcroft. I'm a board-certified family practitioner and specialist in osteopathic manipulation from Berlin, Connecticut, and my practice primarily focuses on integrative treatment of Lyme and other tick-borne illnesses. Although I think they have a really nice product, they're not paying me to tell you anything about that. So, and I'm really standing up here as a private physician who's trying to relay to you what goes on in my practice and how this product may or may not have benefited my personal patients. I'd like to introduce the preliminary results of a pilot study that we've done and sort of get into some of the details of this study and also sort of some of the things that came out of the study that have really sort of prompted us to look to the future and where we might be able to utilize this product. The product that we're talking about today is called Enhansa, and basically I think the take-home message here is, you know, the product is pure turmeric, and they've done all the special biochemistry for us ahead of time to make sure it's absorbed well and bioavailable. Curcumin or turmeric is used very widely as a nutritional supplement. I did a literature search, and you see that there's a vast amount of information on it as an anti-inflammatory. There's also a fair amount of literature on it being an anti-yeast agent. And what's interesting is it seems like the number of papers in that arena has really been growing over the last several years. And there's also a fair number of papers that are showing increases in glutathione levels, which should be helping with detoxification, which we all know is a pretty significant issue with many of our patients. To look at the effects of Enhansa, specifically on joint and muscle symptoms in patients with persistent Lyme disease, to see if we saw any trends, starting at 600 milligrams once a day and gradually increasing that to 600 milligrams 3 times a day. At 600 milligrams once a day, all your pain resolved. You would just stop there. Or if you had a flare of your symptoms, you know, maybe from yeast or detox or what have you, they were to call the office, and then we would, you know, work them through that. But we could certainly, in a time of a flare, we would either keep the dose where it was or maybe even decrease it. And specifically, you know, we were focused on patients that had arthralgias, myalgias, and back pain. And all 7 of the patients who are being presented today did reach the 600 milligrams 3 times a day target dose. So when we look at the severity and frequency data, this was pretty exciting to me because the severity of back pain was reduced, you know, from an average over the 7 people of 1.14 to 0.79, and while it did not meet the p less than 0.05, it certainly is less than 0.1. And for a population of 7 people over a period of 4 weeks to see reduction in the severity of their back pain of that nature was really promising. And we saw a very similar change in the amount of muscle pain and how this was reduced with the same p-value. And a lot of people reported that they had initial headaches and or some pretty significant moodiness and irritability that generally sort of went away within the first 2 weeks of the study. And so my question kind of is this sort of a yeast die-off reaction? Could it be a toxin shift? The possibility for adverse effects, you know, when looking through the literature are very small. Calling all the time, her back pain's been horrible, narcotics don't work, like nothing works for her. And if you don't fix her within 2 minutes after her leaving the office from any given office visit, you receive a phone call later that day. Says, I don't ever want to stop this stuff. She had a really dramatic decrease in the frequency of her back pain, for which she's had injections and all kinds of other things on top of her narcotics and her antimicrobial therapies. So messages here are, you know, that Enhansa has led to some pretty significant improvements, especially in lower extremity frequency of pain, as well as upper extremity frequency, and then back and muscle pain severity. Curcumin in general has been very well supported to be anti-inflammatory, antifungal, and also to increase glutathione in the literature. One of the other things that we always have to remember is that there are the potential for flares, as in any of the therapies that we do. But in my experience, both with this study and using Enhansa outside, of the study group, the flares are fairly manageable in the similar ways by promoting detoxification and all the other things that we're used to doing on a daily basis. 85 or 90% of my patients get this covered by their insurance, so that's really been a nice benefit as well. So.